meniscal sign, but it's, usually meniscal sign doesn't refer to this one, more commonly known as crescent sign. So it refers to, last week we explained on this, so it refers to the moon-shaped airspace inside a cavity which is occupied by another ball or stuff, example mesotoma or aspergillosis. So of course you read the text, you don't understand, so I show the picture. So the arrow here quite pointing, quite obvious. So here is a nodular lesion. Then you can see another hyperopaque ball inside here, and you can see on top here got a small space of air, and this is so-called the crescent sign, which last week we mentioned again. So anyway, this week we will talk about mediastinum pathology. So we tend to forget, especially in those senior we understand, we tend to forget our anatomy. After our exam, we forget everything. So it's good that and so especially for the junior, you should remember your anatomy until you graduate. So we'll revise a bit about what is mediastinum, those things. So can somebody tell me what is mediastinum actually? Louder.
The complex of organs in the thorax. It's a space.
Almost correct. But lung is also in the thorax, right?
So between the two lungs, most specifically is between the visceral pleura of lung.
It's a space containing multiple of organs in between two pleura of the lungs.
Yeah. So basically, we got two lungs. So whatever organs, it's called complex of organs between the two lungs, or more specifically between the inner pleura or the visceral pleura. Whatever organ inside there is considered mediastinum. So actually this is a very last topic because we can see what organ. So here is basically the cross section of your thorax. You can see your mediastinum. So what organ you can see here? Heart. Some more.
Aorta,
Aorta.
Ascending
arch, then the descending. Some more. Louder. Vena cava. This side you can see is on the other side. So yes, vena cava. Some more. Lung hilum, which consists of the bronchus, the bronchial, the pulmonary artery, and the lymph node. Thymus, yeah, very good, especially in children. Some more. Esophagus, yeah, you can see esophagus here. Some more. Trachea. Sympathetic trunk is inside there, but because it's too small, so we can't see in X-ray. But yes, it's inside there. Some more.
Thyroid.
That's when enlarged. Because thyroid usually located in the neck, right? But unless it's so-called the retrosternal goiter, then it will somehow it descends down, so you can see inside the thorax. So you can generally see the you can expecting what pathology is occurring when the mediastinum is looking abnormal. So even though internet says it's a normal chest X-ray, but you can see it's not very normal, right? But the internet says this one is a normal chest X-ray, so you can see the mediastinum. So some normal stuff about mediastinum. So 1/3 of the mediastinum is located on the right side, 2/3 is located at the left side. So you can see 1/3 is on the right side, 2/3 on the left side. So I found this picture on the Facebook, and I think someone also think it's very good picture, so also you see pictures. So so you can see although it didn't draw every picture, every structure here, but you can see the main structure, the heart here, and the vessel, and esophagus, this one is the trachea, and esophagus behind. So anyway, one important thing I want you to learn for the anatomy is that you must know the normal contour of the mediastinum actually. What is the structure that constitutes the contour of the mediastinum in the chest X-ray? So we can see left side and right side. So we start on the right side first. So on the right side first, initially, they're including this bronchocephalic vein, which usually we can't see, is on top here. Then we can see first the superior vena cava. Then you can see the right atrium. Then you can see a small vena cava down here, inferior vena cava. And so the question is, what is right ventricle? Behind or in front? In front, right? In front, usually here, the right ventricle is here actually. It's not, even though it's right, but it doesn't at the right side of the hemithorax. I mean, it's not right side here, but it's here actually. That's why in case of right ventricle hypertrophy or enlargement, so clinically you see left parasternal heaving, not right parasternal heaving. You see left parasternal heaving. This one is for 38 popular. During clinical examination, you see left parasternal heaving because actually the heaving is you can see you put your hand there, you can feel the chest is pushing toward you. That's why it's called heaving, means lifting up.
Heaving.
So remember, right ventricle doesn't constitute your left heart border or the left contour of the mediastinum. Oh, sorry, right. Then for the left heart border, so first we can see aorta here, the aortic arch. Then you can see this so-called the left pulmonary artery, or so-called the main pulmonary artery. Then you can see a small left atrium, or the more correct term is left atrial appendage. Then you can see our left ventricle. So we can divide our mediastinum into anterior, medial, posterior, and also in some case superior. But superior rarely we use, especially superior we rarely use in terms of chest X-ray. So here, and we usually better see on the lateral chest film. So how do we divide into anterior, medial, and posterior? What is the borderline between anterior, medial, and between medial and posterior? What is the borderline? Any attempt? From the sternum until
anterior part of the heart.
Anterior part of the heart, so that one will be the anterior. Middle is for
The heart.
the heart itself, and including the great vessel. And the posterior is I mean, obviously it's from the posterior of the heart to the end here, the paravertebral gutter here. A very terrible drawing. But so you can see the green color here is the anterior mediastinum. The middle is the purple color here, which is constituted the heart and also the great vessel. And the behind part will be the posterior mediastinum. But of course, in internet you can see other people classify it in other ways. So, example, another picture here, they include heart in the anterior mediastinum. So you can see there's not a so-called universal or the international classification, but they got different classification you might see in internet. But I'll stick to this one, which is more useful clinically, I think. So let's say you see here's an X-ray. You can see the mediastinum is so-called enlarged. But we can see that, example, you can see here enlarged, here enlarged. Here is that something come out from the middle of the chest, and here something like come out from the middle of the chest. So how do we? So the question before we ask ourselves, what part of the organ in the mediastinum, we should ask: is it mediastinum or is it lung itself? So here got 4 X-ray. So which of them is from the lung? 1, 2, 3, 4. Which one is from the lung? 2 and 4 is from the lung. And this 2 is from mediastinum. So why do you say so? What is your argument? What is your supporting evidence to say this side of number 2 and number 4 is the from the lung?
Control of the heart still.
The control of the heart still
visible.
So you can see some so-called abronchogram inside here. And what you're trying to say, I think you're trying to say that the region, the contour is indistinct lah. You can see it's like very hazy like that. Right? Compared to here, you can see a very sharp, clear, demarcated border. So how you differentiate mediastinum and lung? So I mentioned some easier one first. For example, the edge is smooth and sharp, and lung sometimes you can see is the mass is surrounded by some lung tissue. So example you can see this one you can see here still got some lung tissue here surrounding lah. So but let's say it's coming from the mediastinum. For the lung usually the angle will be more acute and from the mediastinum more obtuse. So I demonstrate here. What the angle I try to make here is this one lah. So if from the mediastinum you can see the angle is larger lah. If from the lung, then the angle will be smaller. So example, you can see the angle here is it's very blunt, right? I can say. Compared to this one, is sharper, almost 90 degrees, and this one is also about 90 or 90 degrees like that. And usually for mediastinum structure, the lesion is from the mediastinum. Usually you will compress other structure or maybe even displace it if the structure is very large. So anyway, here's the simple scheme. The anterior, which consists of the thymus, thyroid, and lymph node also occurs in the middle mediastinum. The posterior usually consists of the the nerves, actually the spinal cord. Sorry to say CTP, I don't quite remember what does it stand for, but never mind, we will go through it anyway. So we will start with anterior mediastinum. So since we know what organ is in the anterior mediastinum?
Thymus.
Thymus, some more?
Thyroid.
Some more?
Lymph node.
Lymph node. So we can see some differential